and welcome back to Parenting SOS. Now, childbirth is a huge thing to experience, and although I'd love to surround myself with only positive birth stories, the reality is not straightforward for many. The lasting impact that birth trauma can have on millions of mothers is frequently overlooked. Now, today we have the pleasure of speaking with Dr. Rebecca Moore, a perinatal psychiatrist with over 2 decades of experience treating patients from suffering from infertility, pregnancy loss, anxiety, depression, OCD and trauma. Dr. Moore has a particular interest in birth trauma and co-founded the Birth Trauma Conference and Make Birth Better in 2018 to address this important issue. Hello, Rebecca.
Hello, good morning.
I
That makes me feel really old.
Does it? It's amazing though, isn't it, how you can suddenly rack up 2 decades of doing something. You're like, oh gosh.
Yeah, really old, but in a good way, because I love it. So, it's flown by.
Really? And I guess also as your time doing it has increased and you've got more experience under your belt, it's not that surprising that you become really passionate about one area.
Yeah. And I think I was really lucky because I've seen things evolve and change so much over 20 years about how we think about pregnancy, how we look after people in pregnancy, that the whole conversations we're having. So that's really great to see that, we talk about things a lot more.
Well, you're certainly a part of that if you've created a whole conference where people can come together and specifically talk about birth trauma, something that, I definitely feel like I am guilty of we had a little thing a little while ago where I shared something about how people love to share negative birth stories when you're pregnant. And actually on that post, I had a few comments from people saying, but if you've had that, if you have birth trauma, actually being told that you can't talk about it is a really negative thing. And I had never thought about it in the way of actual birth trauma. It's not someone like, talking about an unhappy holiday where, talk about that bad food catering or bed bugs all you like. It's actually something that they've gone through and experienced. And actually it's so detrimental to not give people that place to vocalise that, because it must be a massive thing for them to even feel like they can share.
Absolutely. And I think that, it's a very difficult dance, isn't it? Because we don't want to ever frighten somebody or scare somebody, but we have to talk about the fact that birth takes so many different shapes and forms, and that not all of that is positive for everybody. And I think if you feel that you can't share that, it's a really lonely place to be.
Mm-hmm.
And that was my part of, drive to set up Make Birth Better, was when I was seeing women in clinic and I'd known them for a long time and they were coming back for the first time after having their baby, they just wanted to talk about their birth experience. And they wanted to just go through it and talk about it and process it and think about it. Because so often, society just says, we have a healthy baby, so, what have you got to complain about? Or they just felt very minimised or dismissed. So that was part of my drive to want to share all the birth stories, because there'll be somebody listening today that actually hears some version of their story and feels, gosh, it's okay to talk about that. And that's why it's so important.
Absolutely. On Parenting SOS, I ask you to come in with 3 questions. I would have talked for longer at the start, but the first one is probably very, very important for us to dive into. And that is, what is birth trauma?
Right. So I think increasingly I like to think about perinatal trauma, because you can have your trauma solely related to the birth itself, but often for people they have layers of different events. So, if you think somebody might come into pregnancy after IVF, they might have a very difficult physical pregnancy, then they might have things happen during the birth, and then there might be something postnatally, perhaps around breastfeeding. So, I like to think of it really as something that happens within that kind of maternity journey. Mm-hmm. And really what it is each person's subjective sense of something about that feeling incredibly difficult, overwhelming, frightening, that really goes beyond your capacity to cope in that moment. So you feel very frightened that something awful is happening, and that can be due to lots and lots of different factors, and each person will have their own felt sense of why that felt so difficult. We know that it can affect partners as well, and we know that unfortunately it affects a lot of women each year. So, you know, at least 30% of women will find some part of their maternity experience traumatic, and then a smaller proportion go on to develop a clinical post-traumatic stress disorder. So it's big numbers of women that are having these experiences. And I think we're probably talking about it a bit more and thinking about it a bit more, which is great. But rates are really quite static, and actually if you look, are similar across the world. And unfortunately during COVID, I think, you know, they probably went up a bit, you know, which you can well understand why that might be the case. So it's really important because it's big numbers of people that are being affected. And I think also just want to kind of touch on the word trauma, because I think that, you know, for some people, that's perhaps why they don't think I've had a traumatic birth, because they might associate trauma with things like war or soldiers, or, you know, that might be their perception of what trauma means. But really, in reality, there are many things that can cause trauma, and birth can absolutely be one of them. We don't have to call it trauma for you if it doesn't feel right. So sometimes I will talk to people about it being a birth that you just can't forget. It's so with you all the time still. And you talk about it to everybody, the person on the bus you haven't met, you end up talking about your birth over and over again. Or it might be the birth that you cannot think about at all. And those can be signs of trauma. So I think sometimes the language of trauma alienates some people for thinking, I can't have had trauma from birth, but you can. So it's good that we're, you know, kind of thinking about that.
That's really, there's a lot to think about within that, because certainly, you know, if we have trauma, in my mind is, you know, it's definitely, it's just that letting your mind know it's okay to reframe how things sit in your mind as well.
Yeah, absolutely.
The second question that you get asked most is, how might I feel with birth trauma?
So everybody feels very different, but we kind of tend to see a cluster of different symptoms that you would expect to see. Sometimes that happens for people incredibly quickly. So I've had people where, you know, they've come out of theatre and are in recovery and they're already starting to have feelings. But actually for a lot of people, trauma symptoms can peak at sort of 6 to 12 months postnatally, or sometimes even in a second pregnancy or a subsequent pregnancy, because you're kind of then going to have another birth experience. But typically we see sort of 4 big patterns of symptoms, I suppose, for people. So the first is kind of reliving the birth. And that might be that you're just going over and over it in your mind, but in a way that feels like you don't control that it's just there all the time and you're going through it all, and that your memories are incredibly vivid and sharp. And it might even feel that you're actually physically back there in time because it's so powerful and strong. Or you might relive it in your dreams, you might have nightmares, or sometimes it can be bodily felt for people. So they might feel that they can physically feel a forceps birth again, or they might have pain in their scar, perhaps. So all different ways where you're just basically going over and over and over it, but very much it feels like you can't control that. You don't want to go over it again, but it's just sitting there in your mind all the time. And then alongside that, you get sort of avoidance symptoms. So there might be, for some people, I just can't think about my birth. I don't want to talk about it. I don't want to go to a baby group because I don't want anybody to say to me, how was your birth? Which of course most people ask those kinds of questions. Or it might be that you can't go past the hospital, you drive a different route. Or it might be that you don't want to have another baby because, you know, you just can't think about it. And that can have a real impact for people sexually sometimes in their relationships. Or sometimes it might be that the baby is really difficult for you because they're a little being that is so linked to your
Yeah.
birth experience. And obviously that sometimes can be one of the things that's most distressing for people, because having to balance those two things together is really, really hard. And then the third group of symptoms is sort of feeling very on high alert. So trauma, really, you know, this terrible thing happens to you where perhaps you feel that it's completely out of control, you're going to die, you feel overwhelmed. You then come away from that really feeling that the world is unsafe. And so you're kind of scanning for risks, expecting other things to happen, on sort of high alert. You know, if you think about those little meerkats popped up and kind of scanning around, I always think, you know, that's quite a good analogy, because you're literally like looking, scanning, waiting for something to happen. And often that flicks onto people for their babies. So they're worried that, gosh, is something going to happen for my baby? So they might be checking the baby all the time, you know, not able to sleep, watching the baby, checking them through the night. And then the fourth group, is just really a sort of altered sense of joy, negativity, feeling worried. And I think particularly pertinent to kind of mothers and parenting, there's often a lot of shame and guilt of, I didn't birth well enough, I failed, my body failed, I didn't do it right. You know, which I think you often hear people talk about.
It's so
And that can
hard,
be
isn't it? Because
so hard.
I feel like I love the idea of a birth plan, but I think people then get so set on a birth plan that when it deviates, it's a really emotional thing, a difficult thing to kind of go, I didn't do what I set out to do. And actually, I don't know whether it's when we write those things or when we think up those ideas, those ideals that we have going into birth, whether we kind of go, this is what I would like. However, I understand that it could deviate from this, and I accept that whatever, you know, I accept my body for whatever it does. You know, but again, it's very easy to rationalize that when you're not living it, you know.
Yeah, I think that a lot of this, you know, would feed into sort of broader antenatal education, probably for me. I think we could do a lot antenatally to really inform people about birth. And I think it's one of those conversations, again, where we could do more to empower women and their partners without scaring them. So I think, you know, for me, it's that you can have birth preferences of what you hope to happen. And absolutely, of course, you know, that's a good thing to think through. But I think what's missing from that is a conversation of, so, okay, that's what we hope will happen, but say that you need to go to theatre, what would you like to happen in theatre? What could make you feel more in control in theatre? And, you know, do you know about a forceps birth and a ventouse birth, what that really means, what the risks are? And so many times I speak to people and they say, I didn't have any of those conversations. So when suddenly in the moment you're tired and in pain and worried and somebody says you need a forceps, you just can't compute it, understandably, because you haven't even dreamed that this might happen to you. And I think if we did a bit more of the kind of conversation beforehand, that would really help people to feel less traumatized in the moment.
Yeah, absolutely. I'm pretty sure I've read you've written somewhere, I think this is the right number, that 50% of women who go through birth trauma won't talk about it. They won't actually address it. They'll just kind of hide it. Is that right?
That's all perinatal mental ill health. So anything, depression, anxiety, because there's such a stigma around, am I going to be judged? Will people tell me I'm not being a good enough mum? And, the basic fear for most people underneath is, are you going to take my baby away from me?
I
If
thought
I,
that the first
yeah,
time the midwife was coming to see me at home, I was like, I've not got anything together. She's definitely going to take my baby away. You don't.
exactly.
I
Yeah.
think it's interesting that so many women, that's where their mind goes to, even
Mm.
though we've never met a single person who's maybe, but
Yeah.
hopefully, and it's that. It's just, I think, because we don't see each other in that very raw state of the early
Mm.
days anyway. So then pile on everything else, and your
Mm.
mind just takes you to different places for sure.
Yeah. And I think it's also for me, it's so difficult because we ask people to reach out for help. And
Yeah.
it's so hard sometimes to reach out when you don't really know what's going on. You're not sure if it's normal or not. You're worried how people are going to, what will people do with that if I tell
Yeah.
them? And, we do know that, sometimes people do pluck up the courage, and it is hugely courageous to do that. And they have a great response, but sometimes people don't. So, it's very variable as well how people's stories are met.
Mm.
And really what I would like to see is us to have spaces where postnatally, at the 6 to 8 week check, which doesn't even really happen for some people anymore, or it's online, that instead of just being asked about, bleeding and given a leaflet about contraception, which is probably the last thing on most people's
Yeah.
minds at their 6 week check. Of course, it's important, but that we could have a space just to say, how are you? How was your birth? How did it go? Just on a kind of human level.
Yeah.
Um, because for a lot of people, that's their only big chance where they feel like, can I start this conversation?
Mm-hmm.
And then, it really gets reduced down to kind of feeding and contraception and nothing more. And I know part of that is because GPs are so time pressured, and this is
Yeah.
not a kind of anti-GP thing at all. It's a we need to make these spaces for women to come and talk.
Yeah. And we asked the Have Mum Have Baby community to send in some questions for you. There were
Fab.
lots, and I think it does definitely feed into that whole idea of Instagram. You can just send off a question, no one else needs to see it. And,
Yeah. Yeah.
So someone has said, where do you start to get over giving birth in the pandemic? Scared, alone, and unprepared. I mean, all those women during the pandemic, which,
Yeah.
this
Yeah.
other side of, am I going to be allowed, anyone in with me? Are they going to make it? Is this going to be a very
Yeah.
lonely, isolated experience? We know the images of midwives in their PPE and,
Yeah.
very, like, it's so easy now that we've moved on and things are, like back to normal for nearly everyone, to kind of forget those images that we were seeing in hospitals.
Yeah. Yes, absolutely. I mean, first of all, like, I just want to give you a big dollop of love and a hug,
Yeah.
because that actually makes me want to cry.
Mm-hmm.
Like, just like you can take yourself there of what that must have been like. So strange and so frightening. But I think there are lots of different places that you can find support. So, obviously for a lot of people, formal support routes come for most people via their GP. It may be that they can refer you for some therapy. There are lots of new specialist teams that focus solely around trauma in the UK. So sometimes they might be able to offer you a piece of support just to kind of unpick that experience for you, and for you to say, what, that was really tough. And you absolutely deserve that space and time. There are lots of communities online, I think, which can be really super helpful. So, you can look at Make Birth Better, you can look at the Birth Trauma Association. I'm not saying that you necessarily have trauma, but there are definitely, lots of people there that have spoken about their experience of giving birth in the pandemic. There are some blogs that Make Birth Better around that. But I think, for me, I think a bit of therapy might actually be really great for you to kind of unpick that all. Often people don't need a lot. They just
Yeah.
need, a few sessions to feel really heard. And for somebody to actually say, oh, that sounds really hard. I'm so sorry that, that happened for you, because it was so tough for people. And also beginning to parent was so tough, because
Yeah.
everything people imagined didn't happen, and couldn't see their family. And so I would look at those as initial places of support.
Amazing. Someone has said, what are the signs of birth trauma, which we have touched on, but she said it took her 2.5 years to realise that she even had a traumatic birth.
Yeah, yeah.
So
I think that's not uncommon.
really,
Often it takes a while for it to kind of filter through, and for you to kind of recognise what happened, and perhaps it's not been framed to you as, perhaps you felt that everyone said you've got nothing to complain about, or so you feel like, well, maybe I can't talk about this. As I said, it often pops up in subsequent pregnancies for people. But I've given talks where people have come up to me at the end and said, I've just realised that this was my experience 20 years ago.
yeah.
So, it can sit with people for a very long time. And
And I
often it's
think,
about allowing people to reframe it and think, what, actually, yes, that did happen to me a little bit or a lot, but just allowing them to speak about it.
someone has said, I was told my traumatic birth was extremely bad luck. And I still feel like now, 4 years later, I have no closure and it's put me off trying for a second baby. How can I move on? And someone else has asked, how do you go into your next pregnancy and birth without fear? I thought I'd loop those two
Yeah,
together because they're both about
sure,
subsequent.
sure. Well, firstly, it wasn't bad luck. It
The
wasn't about any.
wording, the
Yeah,
wording, it's
so
awful.
trauma is often about language. So people can quote things that were said to them verbatim years
Really?
later and how it made them feel. And it's like it's burned into their brain forever. So I could spend hours telling you the terrible things that I've heard, said to people,
Yeah.
and then how it subsequently, of course, makes them feel. So it wasn't bad luck. It wasn't your fault. It wasn't anything that you did wrong. It was something that, obviously did not go as it should have done. And, it's never about something you've done. Sometimes people have a debrief. It depends where you are down the line. If you're sort of a couple of years down the line, not all trusts will offer them. And I have to say that people's experiences of debrief is variable. Some people find it very helpful, some people don't. But again, it might be something that you speak to GP, health visitor, family, just to kind of unpick that, again, because what matters is how you felt it was.
Yeah.
That's what matters. And if you felt that something about it was really wrong, badly managed, made you feel frightened, then that's what it was. And we start from there. So it absolutely wasn't bad luck. But I completely understand how horrible that is to hear, because it's so silencing.
Yeah.
I think in terms of future pregnancies, understandably, people do feel anxious because you're going back into the situation where your trauma took place. There's a lot of good stuff on Make Birth Better about planning subsequent pregnancies. So I would think about everything that you can. I always talk about asking people to think what they don't want to happen again, because I think sometimes that's easier than what do I want. But you can usually, people will say very clearly, I don't want that to happen again. I
Yeah.
don't want that for pain relief. So things you might think about is a different trust, a different place to give birth. You might think about asking for continuity of care if that's possible. So you have a named midwife who you can build a connection with. You might think about different ways you want your pain to be managed. You might want your partner to advocate for you in a different way. Some people want to have a planned cesarean because they feel it gives them more control.
Mm-hmm.
Some people want to free birth. You know, it's very, very variable for each person, but really think about the things that you found most difficult and try to map out a different team, a different place of birth, a different way to birth as much as you can. You know, sometimes people will have a doula. I
Mm-hmm.
know that's not accessible to all, but, you know, if it is, they can be fantastic advocates for, you know, really making sure that people's wishes are heard. So just anything that you can do to build this in. Some trusts also offer birth choices appointments, so you can go in very early on and start to have all these conversations about, you know, what I want for pain relief, where I want to be. All of those things I think help just build a sense, hopefully, of safety and feeling more in control. And absolutely, you know, for many people, they can have a really empowering and totally different birth experience. So it can happen. But I think you have to get as vocal as you feel able to, as early as you can, and really start to pull all these different strands together.
Someone has said, how do you move on from birth trauma when you keep reliving it? I still relive it in the middle of the night while feeding. You
Yeah.
referenced that earlier, and I can't sleep. How can I move on? Oh,
Okay.
bless her.
Yeah. So I think you describe your, you know, that so clearly and vividly. I can
Yeah.
really feel that for you. And I think, you know, it's with all of these things, if it's continuing to impact you day to day, then you need to get some proper support and treatment. And actually, a lot of the therapies used can really help people process their trauma. And you can really feel like you assimilate it in a different way so that, you know, it doesn't control you anymore, that you can come back to it if you want to, but it's not just constantly there all the time. So I think for you, it would be really great if you could get some trauma specialist talking therapy. I don't know how far down the line you are with your little one, but if you're very newly postnatal, you can self-refer to IAPT, which is IAPT. If you type that into Google with your area, say you're in Surrey, say, it should pop up and you can actually self-refer and you'll be prioritized as a new parent.
What's the
If
window
you're
for that?
so they tend to do it up to a year, but definitely if you're very newly postnatal, they will really try to prioritize
Right.
you. Other trusts have like trauma specialist teams, so it might be worth trying to speak to your health visitor or GP, and they will be able to, you know, get you to the right person because each area is slightly different in what they offer. But I think for you, like, try and think about doing that, and you know, it will help. You haven't had any, you know, support yet, so you're battling
Yeah.
it all on your own.
I find it incredible how so many women try to battle through things on their own, how we really struggle to ask for help. And it is that
Yeah.
control thing. It's that whatever is in your head it has the control. And actually by speaking out, you're taking the control away from it, what you know, and so I feel like in many ways that tries to claw you in even more.
Yeah.
But you've got to kind of, it's breaking away from that, because then, you know, with help it can all get so much better.
Yeah.
Yeah. Someone has asked, can traumatic childbirth negatively impact breastfeeding and bonding with newborns?
Yeah. So with feeding, yes, there's a lot of different reasons for that. So if you've had a very traumatic childbirth that perhaps, say, has stemmed from something physically, you might have had a bleed or been physically unwell, it can actually just affect your milk flow because you've been poorly.
Yep.
So you might have less milk. And it really tends to propel people on two different routes, I find. So the one is where you've had a traumatic birth and then people become preoccupied with feeding because they feel like this is something that I can do and get right. So they really push themselves to feed, sometimes in a way that, you know, is at detriment to themselves, because they just feel like I have to get this bit right. But then for another group, it can be intensely healing because you've had this difficult start, you've felt all over the place, detached, all those things we talked about going on. And feeding can be this lovely moment of grounding and connecting and feeling I'm doing this really, really well. So I think it can affect it for sure.
Yeah.
In terms of bonding, I'm always really, really mindful of talking about birth trauma and bonding because there are so many things that affect the way we bond with our children, millions of things. And it is never about your birth trauma, meaning that you're a bad mum. And I really want people to hear that because, yes, there might be some things we see, but that's not because you're not a bad mum and you're not doing absolutely the best that you can with where you are.
Yeah.
So, as I said, sometimes it does make people very super protective of their kids because they're expecting something else to go wrong. So they might not even let their partners look after the kids. They don't want to be separated from them. They don't want to take them out. They're checking them all through the night. That's the commonest thing I would see, really. It's rarer for people to kind of really actively avoid their baby. But sometimes they do. And again, all those things can be treated. So a lot of services now have nursery nurses, parent-infant workers that can do a lot of work around connecting that bond. And, it's also important to know that not everybody loves their baby straight away anyway.
We have this very Hollywood view of what happens after birth. And I think, because it's a question that I used to ask a lot actually on the podcast, is, did you feel that bond? And I was amazed when people answered, no, because that's what I felt. I didn't. It was an alien thing. He was living inside me, and now he's here, and all of it. It takes a while, I think, for brain, heart, body, everything to sort of connect. You've gone through this massive experience of giving birth, but it's the way that we've seen it. It's been told. We've been given the narration, the narrative, and when we don't go down that path, or it feels a little bit, clunky, I guess, in a way, we immediately start to go, oh my gosh, I'm rubbish at this. I don't know my baby. What does this mean?
Yeah, and of course you don't know your baby because you've just met them.
Yeah,
you don't meet anybody else and think I'm going to know everything about you immediately.
Yeah.
You're learning to be a mum. You're learning them. You're learning what they do, what they don't do. For most of us, it's incredibly messy at the beginning, and we're like, have I made a mistake? Am I doing this right? What's going on? Where's my old life? There's all these hundreds of things going on. So I think, again, it's one of those things that I think takes time to filter out in terms of trauma itself.
Yeah.
And virtually everybody wants to care for their baby, of course. But, actually not many people would, I think, truly say, I love my baby immediately. It takes time.
Yeah, absolutely. What are the potential long-term effects of a traumatic birth on a mother?
Yeah. So I think, if untreated, they're massive. So, you really think about all the ways it ripples out. So for mum, obviously, she might be having all these really distressing feelings and emotions that need treatment in their own right. It can really affect your relationship with your partner. It can affect your relationship with your baby. It can affect your whole kind of sense of self and safety in the world. It often affects people in terms of work, like confidence. So loads of ways that, it can have an impact. All of those can be addressed and treated with the right treatment and support. Yeah. So I don't want people to think that, in any way, shape or form, it's not untreatable. But I think people underestimate how big the ripples can be. So sometimes people might feel very triggered, for example, by being touched. So, you know, they can't have sex, they don't go for things like smears, they, you know, physical health implications. So, you know, it's really important in so many domains of people's life.
Yeah. Someone has asked, final question. What advice do you have for dads or partners who have witnessed birth trauma?
Yeah. So I think, you know, to know that absolutely what they're feeling is real as well. And that we do have a growing literature that dads and partners can be affected and have birth trauma and PTSD from birth. It's mainly around fathers at the moment rather than sort of same-sex couples.
Yeah.
But there are some people looking into that at the moment, which is great because that will really help our understanding. And it's often very interesting because sometimes I see couples and both of them will have a different story and trauma. Because if you think about physically where dads just are positionally in a room, they really see things unfold. And they often feel that they get pushed further and further into a corner away from mum if things are going on. So they're really watching things unfold and often see different details that mum doesn't see because she, you know, might be lying flat or, you know, she's in the moment of giving birth. And that men tend to present with all the same symptoms as women. So they can have any of the experiences that we just spoke about. Yeah. And I think probably for men, you know, for me, I would really like services postnatally to be family focused, not women focused. Of course, it should be women focused, but I would like it to be thought of in a more holistic family way. Because often dads will feel like once mum's had the baby, there's nothing for them. But there are some really amazing dads that speak about birth trauma in particular. So, you know, Elliot Ray speaks about it.
We've had him on the podcast. It's incredible.
You know, so he's been an amazing voice for really talking about this, and it really wasn't talked about at all until a couple of years ago. And I think many of the new perinatal services are also now looking at assessing partners as well postnatally, which is great. So hopefully we will pick this up for partners as well.
But it makes total sense because you are placed in an environment which you know nothing about. Everything is so overwhelming, can be massive. That's the person that you love, certainly carrying your child, going through, you know, and then that helplessness that must overcome, you know, and just, you know, I think when you've seen something like that, there definitely needs to be some aftercare. You have to be included in the conversation.
Absolutely. And you know, dads will often, they really talk about that helplessness and powerlessness and feeling that they've let their partner down. You know, I couldn't do anything for her pain. I couldn't, you know, resolve things. And I think often classically then they kind of bury their feelings because they will want to be there to support their partner. Or often with, you know, partners, I think you see them, you know, they go into this busy mode of going back to work, looking after their partner, you know, so it perhaps presents in a slightly different way. But we're definitely thinking about it and talking about it more, which is really good.
Yeah, absolutely. Final 3 sentences that I'd like you to complete, please, Rebecca. Although I always feel like when I've got a doctor and I have to call you Dr. Rebecca or Dr.
You
Moore.
really don't have to call me Dr. Rebecca.
You're a doctor. You've worked hard to get the doctor. You should include the doctor in every single sentence. Okay, being a parent means...
constant, beautiful change.
If I could tell you one thing, it would be...
don't minimize how you feel. How you feel is valid.
And I'm happy when...
oh, gosh, that's a tricky one. I am happy when... personally, when I'm just with my kids and my family and we don't have anything to do, we're just knocking about and enjoying each other's company.
Yeah.
Professionally, I'm going to cheat. Professionally, I'm going to be happy when we have all these checks in place for people postnatally as families to make sure we're not missing birth trauma for people.
Absolutely. Thank you so much. You know, it's clear to see how passionate you are about this area, and the work that you've done in the 5 years since setting up, you know, everything. It's just brilliant, and we need people like you to keep campaigning so that more and more women get scooped up.
Yeah, absolutely. Thank you so much.
Thank you. Thank you very much.